So our fourth and final speaker for this panel is Dr. Nathan Lachowsky from the University of Victoria, as well as CBRC's new research director. So Nathan is an assistant professor in the School of Public Health and Social Policy at the University of Victoria. He uses community-based research approaches with gay, bi, queer, and trans men across Canada and New Zealand to improve sexual health and address other health inequities.
Excellent.
Is this a clicker?
Yeah. Nice. Hi, good afternoon, everyone. Thanks for sticking it out to the end. So I'm presenting on behalf of my co-authors, Dr. Mark Hall, and Paul Sarita and Clara Wang, who are at the BC Centre for Excellence in HIV/AIDS, as well as Josh Edwards, who is the Program Manager of Knowledge Translation at Health Initiative for Men. And this is really a quick survey that we wanted to do, I think really with two main aims. One was to try and help support a bit of program evaluation of a recent campaign that the Health Initiative for Men had launched called GetPrepped, as well as to get a sense of what are some of the perceptions in the community around PrEP. And I know we've been talking about a lot of things related to PrEP over time, so I have a very brief background and want to thank all of the previous speakers for the whole conference so far in terms of setting this up. And so fundamentally, I mean, the key part here is that we wanted to look at community level attitudes around, and self-reported use of PrEP. So this was to try and give us a snapshot at the very beginning of 2017 around what was going on in Vancouver. So when we've heard speakers from lots of different jurisdictions, I think we've heard that access is a really big issue that differs across geography quite a bit. And so we wanted something local to try and help inform some of the conversations that were happening. And as I said, it was linked to the Health Initiative for Men's campaign, which you can go see at GetPrepped.ca. And him was grateful or supportive of providing social media boosts for the survey to help get guys into this. And so if you go to this campaign, we basically linked right off of the campaign webpage. I'm not going to try and do that because technology. In terms of eligibility, we tried to keep it really just kind of broad, so 19 or older and identifying as gay, bi, or queer. And we had 3 different groups, and I think this was really important to us, and I want to echo some of the comments that folks have made from community particularly about the importance and involvement of guys living with HIV around PrEP. A lot of these men have a lifetime experience of managing medications, and this is something that I think can be a great asset for guys that are considering and taking PrEP. As well, they understand a lot about HIV, and I think are some of the best educators we have in our community. So we were interested in including PAWS guys in our study, and I encourage everyone who's doing work around PrEP to make sure you're considering and including PAWS guys as well. So those are our 3 groups. So HIV negative guys, self-reporting PrEP use, HIV negative guys not on PrEP, and then our PAWS guys. So in terms of our results, we had 254 completed surveys. We had about 50 guys that didn't complete, which might have been because guys don't want to complete the survey. Maybe they were online doing something else. Maybe the HIM campaign was just so engaging that it was much better than doing our survey. Out of those that did complete, we had 1 guy that was too young in terms of the eligibility criteria, and 4 that had a few too many missing answers for us to do anything with the analysis. So for all of these analyses that I'm showing you, we had about just shy of 250 participants. So in our sample, about 3/4 of those were HIV negative guys not on PrEP. About 1 in 2 were HIV negative guys that self-reported being on PrEP. And about 1 in 12 were HIV positive guys. So in terms of their age, what you can see here at the bottom is that the median age was about 40 for those who are on PrEP, which is basically the middle of the sample. That the guys that not on PrEP were on average younger, and that guys who were living with HIV were on average older. In terms of relationship status, we asked guys what their current relationship status was in terms of being open or monogamous, as well as what the HIV status of their partner was, their main partner. So this breaks it down. So in green were our PAWS respondents, in red were our negative respondents who were not on PrEP, and in blue were the guys that were on PrEP. So for guys on PrEP, most of them were either open with a main negative partner or single, whereas for our PAWS participants, most of them reported being single. And for those guys that were not on PrEP, again, most of them reported being single or in an open relationship with a negative partner. So this is just a little bit of a snapshot from the HIM campaign site. I encourage you to all go check it out if you haven't seen it yet. And we asked guys this question around how much did you know about PrEP before visiting this campaign website? And about half of them said they only knew a little bit before going on the site. And for those guys that did the survey after going through the site, we asked them how much the site improved their understanding. And 83% of them said that it improved their understanding of PrEP a little bit or a lot, which I think is great. And generally, I think I want to encourage partnerships between people to try and figure out ways in which we can provide better data to support our community agencies so that the work that they're doing can be scaled up and continue to get resources to do so. So as I said, one of the things we were very interested in looking at were the perceptions in the community. So I probably should have used animations, but I'm going to talk through all of this. So we're just going to start at the top here. So we asked guys how effective they felt PrEP was at preventing HIV infection. And you'll see lots of numbers that were shared from previous studies. And I think one of the things that we saw in some of the qualitative feedback we asked guys is that there's been so many numbers thrown out there around PrEP. And there seems to be a lot of anxiety about what this number is. What was interesting is that during how effective they felt PrEP was did vary in a very small way, at least by the different groups that we had in the survey. So the guys that were on PrEP felt it was most effective they said it 98%. Guys that weren't on PrEP had the lowest level of or perceived effectiveness at 92%, and pause guys fell somewhere in between. All of those are very high. So although there were differences between groups, I think that's important to rate that everyone is seeing this as more than 90% effective. So I think in terms of thinking about sending out a message that doing PrEP works, and I think about the Youth Co campaign about PrEP works, stigma doesn't, I think that message seems to be out there, which is great. Of course, I do want to emphasize that this sample came from a campaign website, so they're likely a little bit different than folks who haven't been exposed to or accessed a website. Now on the bottom, I think this is one of the things that I found most interesting and I think important in our work that we do in education in the community. So on the bottom, we asked them how many guys they knew, gay, bi, queer, and trans men in Metro Vancouver, and what percentage of those guys were on PrEP. So when we take those two answers and we combine them together, in their own social networks, guys reported on average about 5% of their social network being on PrEP. And that really didn't vary by the groups that we had in the survey, whether they were pause, whether they were neg on PrEP or not on PrEP. So that's within their own social network. They're saying, during that 5%, during that 1 in 20 guys they know are on PrEP. We then asked them an open question that just said, what percentage of gay men do you think in Vancouver are on PrEP? And for that, what I find very interesting is that they all reported much larger than their own social network. So there's this perception out there that guys feel like a lot more guys are on PrEP than they even know themselves, regardless of whether they're on PrEP as well. So if we think, for example, about the guys that were on PrEP, in their networks, about 1 in 20 guys were on PrEP, but they thought double that amount were actually taking PrEP in Vancouver. When we look at pause guys in green here, in their social networks, they felt like 6% of those guys were taking PrEP, but 18, so 3 times as many they thought were on PrEP. So I think this is probably one of the things that we saw as the greatest disparity between what we know from the Davie Buyers Club, from some of the trials that are going on, from all of those sources about how many guys are really likely to be on PrEP in Vancouver versus what the perceptions are in the community. And I'd be very curious to hear people's feedback around what might be some of the things that are contributing to that and how we might want to go about addressing that if we think it's an issue. So in terms of the guys that were our current PrEP users in the study, we asked them about how long they had been taking PrEP and how much they paid for it. And so guys said on average they were taking it for about half a year, and that ranged, do you know what I mean, to basically from just starting to just over 2 years. And in terms of how much they paid on average about $10 a month. And that ranged from some guys that paid nothing to some that were paying upwards of $75 or a little bit more per month. In terms of access, most of the folks were accessing it through a general practitioner and insurance coverage, but about a quarter of guys in this study said that they were sourcing it online, likely via Davie Buyers Club, in terms of that process, and 5% said they were getting it from some study source in Vancouver. In terms of the regimen, 90% of guys said they were taking it daily, 5% said they were taking it on demand, and about 5% said they had a different regimen. And thinking about Réjean Thomas's talk this morning, I think that probably reflects a little bit around guys' individuality and the way this is taken up. So one of those guys said, they mainly take it daily, but with gaps for up to a month when I won't be having sex outside of my relationship. And it makes a lot of sense, right? Another guy said they were taking it daily for 1 week before anticipated risky sex and 30 days afterwards. So I think there's a kind of interesting piece there where, for me at least, that felt like maybe that guy was thinking a bit about PrEP regimen and that we take that for 30 days after an event. But when we think about the on-demand of 2 pills before and 2 pills after, I mean, this guy is really taking a lot of PrEP in his own way in that regard. In terms of their last PrEP care visit, guys were pretty well engaged with care provision, which was really good to see, particularly around the fact that for guys that were sourcing it online. So 93% of them had STI and HIV testing at their last visit, and 100% of them had liver and kidney function follow-up. So I think that's all pretty good news. In terms of sexual HIV risk, we asked guys how they perceive their own risk, and we've heard a little bit of folks talk about this in the conference so far. And we also used the HERE MSM score that Darrell and many others have talked about throughout the conference. And what we found is that for guys that were, so in terms of the self-perceived risk, what we asked them was how they felt about that before they started taking PrEP. So for guys that were on PrEP, this was how they felt about their risk before starting PrEP. And then for the guys that weren't on PrEP, we asked them how they currently felt about their HIV risk. And what we found is that for the guys that did end up on PrEP, that they felt that they were at a much higher risk compared they were on much higher risk before they started PrEP. And that same kind of pattern holds for the HERE MSM, is that when we use that objective risk score, the guys that were on PrEP had much higher objective risk scores. What I think is interesting is that we did see a pretty good correlation for those that were not on PrEP between self-perceived risk and the objective risk. And I think that's important because there's, I think, often this message of dissonance between how guys perceive their own risk and whether they're objectively at risk. And the one piece that I would say around these objective risk scores is that they're not perfect indicators of risk, and that there are a lot of other factors that guys will likely be factoring into their own self-perceptions around risk. And I think Réjean highlighted one of the main ones, which when we think about HERE scores, you get 8 points for being under the age of 30, right? So there's challenges with these objective risk measures, and I think that's just an important caveat I wanted to share. So with that in mind, though, we did use that cut point of 10 or higher, as Darrell talked about, as being a kind of indication for considering PrEP. And all of the guys that were on PrEP had, or 97%, sorry, had a HERE score of 10 or higher. So when we think about that in terms of targeted PrEP or in terms of ideal candidates for PrEP or any of the language that people use around that, I think that this is a really good sign that these early adopters align with those kinds of tools. For those guys that weren't on PrEP, however, 3/4 of them still met that criteria and weren't on PrEP. So I think that really shows or highlights the gap in terms of work needing to be done to get access for folks. We also asked about sexually transmitted infections. And for this, what I did was just pull out syphilis as a bit of difference, which I think Darrell highlighted as one of those STIs that varies within our community. And so in terms of those guys on PrEP, what we found is that before starting PrEP, there was 75% of them had reported an STI. And that was significantly higher than those guys that weren't on PrEP. Although the guys that weren't on PrEP, still more than half of them had reported a history of STIs. And then amongst the PrEP users, 1 in 3 reported a new STI since starting PrEP. So I think this is, again, a bit of just early information in Vancouver about how commonly this is occurring. But again, and I think as other people have said, this is part of our response and our responsibilities as sexual health folks to figure out what we're going to do around all of this. And I don't think that it should stop the rollout of PrEP. In terms of PrEP access, so we asked guys that weren't on PrEP what their interest was in taking it. And we asked them just to give us an indication of strength. So as opposed to giving folks this kind of binary, like would you take PrEP or not, we were kind of interested to use a bit of a scale where guys could indicate really high preference or maybe in the middle. And the median value was 81, and that in terms of most of the sample ranged from somewhere between 50 and 100. So only 7.5% of guys that were HIV negative, not on PrEP, said they would never take PrEP. So I think this was obviously a group that had been on this campaign website or was accessing it that likely had an interest in exploring taking PrEP up. We asked guys about insurance coverage, and regardless of whether guys were on PrEP or not on PrEP, just under 3/4 of them or 2/3 of them had insurance coverage. there's different plans and different coverage, and we've heard the term kind of Cadillac insurance. But I think what's important here is that whether someone had private insurance or not didn't differ between these two groups. And I think we can do better in terms of making sure that we're thoroughly working through guys around how their current insurance coverage might benefit them in lieu of a public program. In terms of whether they were willing to pay for PrEP, so 5% of the guys that were on PrEP said they would pay nothing for PrEP, and a quarter of guys that were not on PrEP said they would only be willing to pay nothing. And I think that speaks a bit to what Alex talked about in terms of that there are a lot of guys that can't afford $1 a day, $2 a day to access this tool. And in my opinion, nor should they. So I think that's an important piece in understanding that even if we think about a copay situation, we're going to be excluding a population and just furthering that inequity. In terms of the max that guys said they were willing to pay, $100 was the median value for those on PrEP, and $30 was the value for those not on PrEP. And really, I think that just demonstrates that importance of cost as a barrier to access. What I think is probably most important is that we asked guys whether they were comfortable talking to their doctor about PrEP. And although, basically 95% of the sample said they were interested in PrEP, a quarter of them said they were very uncomfortable in talking to their doctor. And so I think that really speaks to some of the work folks are doing to try and think about different access pathways for guys, because their GPs are not going to be the solution for this, sadly. In terms of PrEP impacts, we tried to ask a few different questions around this. So amongst negative guys that were not on PrEP, 44% said they would decrease their condom use. And I think we've had a conversation about this, and I think what's important for me is not that that slows us down in terms of PrEP implementation, but that we be fully informed about what that's going to mean for making sure we have proper STI follow-up and treatment, and thinking about combination prevention broadly. Amongst pause guys, we asked how much they agreed that PrEP reduces stigma for people living with HIV, and half of guys said they agreed with that, which also means half of guys said they disagree with that. And I think this is going to be, it was an interesting piece for us to just think about what PrEP means in the community and how that means different things for different people. We also asked pause guys around some of the experiences they had in terms of having sex with guys that were on PrEP. And so 60% of the pause guys that responded said they had had a previous partner who had been on PrEP. 90% of those had bottomed without a condom, and 80% of those had topped without a condom. And I think this really, again, speaks to, in the more public health language, around guys having the sex that they want to have. And I think the opportunities this provides for both pause guys and neg guys to work together, to have good sex together. And lastly, we asked this open question at the very end of the survey about what was your #1 question about PrEP. And through no particularly really rigorous qualitative process, I would group these largely into 3 questions. One being around side effects, the second being around access and cost, and the last being around effectiveness and impact. So these are the actual questions that guys typed into the survey. I did a little bit of grammatical correction and punctuation for reading's sake. But I mean, questions around side effects like, are there any lasting side effects of taking PrEP for an extended period? Are there physical side effects or long-term health implications? I think that piece was really clear in guys around, they were interested in this long-term impact. And of course, we have limited data from these trials around that, but I think there is, again, when I think about working in coalition with guys living with HIV, to talk about some of the impacts of taking treatment for a long period of time. In terms of access and cost, there were a plethora of questions around how can I get free, cheaper, affordable PrEP, and is it possible for me to acquire PrEP anonymously and affordably? And I think that piece is that these questions aren't just tied to money. There's a piece, the second question really, I think, emphasizes the way in which guys want to access PrEP. And I think we haven't had a lot of conversations about anonymous access when we think about the work that some places have done around anonymous HIV testing earlier in the epidemic especially. And around effectiveness and impact, I think this is where a lot of, I think some of the challenges for guys in really believing some of the messaging around PrEP comes out. And so there was lots of questions that were kind of, how effective is it actually? Is this for real? A lot of skepticism that I think David talked about on this morning's panel around, is this just a big pharma money grab? Are there not as many people being diagnosed with HIV, and therefore big pharma needs the rest of us to take all this medication? So I think a lot of perceptions there in terms of the role of the pharmaceutical industry, in terms of gay men's sexuality. Other questions, how is PrEP use changing other STI incidents and condom use? How will a pill help deal with social factors around HIV anxiety? How should I know if I have enough sex to make PrEP worth it? These are all real questions that guys articulated that I think really highlight the good work and the important work that frontline providers are doing and will need to continue to do in that kind of one-on-one counseling piece. But I think, all in all, I think to take these questions and for us as researchers to hold them in ways in which we might be able to help try and provide some answers to these. So in terms of strengths and limitations, we recruited the sample from a PrEP campaign website. It was very much a convenient sample. So by no means am I trying to articulate that this is the represented picture of what's going on in Vancouver. But I do think that it was a real opportunity for us to do some embedded program evaluation, and I really hope that supports him in their future work. This was a really brief online survey. So we were trying to keep it, we had this dream that we would have 5 questions. And then we were like, well, the HERE MSM scale, which everyone is talking about, is 6 questions. So then we kind of kept adding questions, and we went through this long process to try and keep it as short as possible, because we knew that that was going to be a major factor in guys completing it. So we don't have other measures that might help us to assess some of the health equity issues. But I do think there's still a lot of good information that came out of this, even though it's not necessarily comprehensive. These are self-report measures, and it really just gives us a snapshot in time. So I think although these data are quite recent compared with some other data that get published and shared and whatnot, this came from the beginning of this calendar year. I think even if we did this survey again in January, we'd probably see a different picture. And so I think it's important for us to be mindful of how quickly things are changing. But what I'm hoping is that if there are public announcements about PrEP programs that come, that they'll be able to really see a change over time in some of these aspects. So in conclusion, I think for us, some of the things we wanted to highlight is that men perceived there were many more PrEP users in Vancouver than they had in their own social networks, but also that other studies would tell us. So the Momentum study doing a recent analysis showed that there were really no more than 2% of negative guys that were on PrEP in any given time period. That PrEP users were aware of their higher risk for HIV and had adopted a prevention strategy. I think we don't celebrate that enough. That is 100% why we're all here in terms of doing health promotion and community building. So yay. And that those on PrEP also had higher risk. And I think that really highlights the work that we have yet to do. Access to a gay-friendly doctor is important. And I think this is important not just for PrEP, but generally for having the comprehensive right to good health care. And that I think what's really important is that few people were willing to pay at all or to pay much. And I think that's really important in terms of articulating the need for a universal access program that is going to cut across income inequality that we have. Otherwise, we're just going to contribute to it. So thanks very much, and I think it's time for questions.